also on the vaccine hesitancy. And WHO takes this extremely serious because, as you mentioned, there are already problems with routine vaccination. And we've seen that the problems are related either to mistrust on institutions or on scientific information, but also because of the very rapid access to incorrect information that happens through social media and so on. So WHO has been working in the past years, and it's intensifying its work with the social media platforms to ensure that there is early detection of incorrect information, and there are also people looking for information that they have access to the right sites that provide solid and scientific-based information on vaccine. But this is absolutely a work stream that WHO is taking very seriously, thinking that we will need to have a rapid uptake in many countries as vaccines become available. Thank you.
If I could just add, some of the things we're doing right now about this issue, in addition to what Mary Angela just said, is that we're engaging with a lot of different groups right now to discuss vaccine understanding, what a vaccine is, what a vaccine does, what it's meant to do, what it can't do, how these are being developed to be a safe and effective vaccine, even though it's a rapid development. The steps are not being skipped. In terms of safety and in terms of efficacy, and also to understand acceptance and demand. And so we're working with different groups to work on communication packages, listening, and so this could be worked on now as the vaccine itself is being developed. But what we understand from most countries that are communicating with us, most groups that are working with us, civil society, individuals, that most people want access to a safe and effective vaccine. So there's a lot of different avenues that we are pursuing, but really trying to increase vaccine understanding, acceptance, and demand is something that we take very, very seriously, and we're listening and we're learning and we're developing those communication packages.
And maybe also speaking to the costs of doing all of this, we need to invest in a dialogue with people, with communities, in creating the conditions in which these vaccines, we hope, can be introduced in the most successful way. There are reasons for vaccine hesitancy, there are reasons for lack of acceptance of vaccines, and they range from specific fears about the vaccine to distrust of government. There are many different reasons, and Bruce has vast years of experience in polio, overcoming issues and misunderstandings and misinformation. Spent many years at it myself. If you think about Congo, Eastern Congo in the last year and a half, we were using an investigational use vaccine, brand new vaccine, in a population in the middle of a highly conflictual situation with a very disrupted society. And through the work that we, UNICEF, the government and others did with communities, we had 97% acceptance of vaccine amongst eligible people for that vaccine. That's incredible. That's a great testament to the people of Congo, to their understanding, to their acceptance. But it's also a two-way street. There must be a dialogue. People need to be allowed to have a conversation about vaccines and have a proper conversation. It's not a one-way street. It's not about shoving things down people's throats. It's about having a proper discussion, good information, a good discussion on this. And people will make up their own minds. And I think science and government have a job to do, and that is to make the case. I think communities and people have a job to do, which is to listen to that case. And hopefully the result of that will be a widely accepted, successful vaccine that could bring this pandemic to an end. Bruce?
Hi, thanks, Mike. And Michael, thank you for the point. I don't want to belabor it because others have covered the big points, but first, no one's underestimating this, and one of the ways and things that we're doing to address it also is to make sure that we're putting together an integrated package of tools, and that's what the ACT Accelerator is all about. We all want a silver bullet, but we want to make sure we have multiple ones. We need better, faster diagnostics, we need therapeutics, we need the vaccines. Not everyone may use a vaccine, it may not work in everyone, so we need the other tools, and as Mike has been emphasizing, we need those tools tools now, especially the diagnostics, to be able to get the massive step change in terms of the coverage of folks who, number one, know their status, whether or not they have the disease, and number two, whether or not they're still shedding and they're isolated properly. So that's the reason, and again, one more of the arguments, as we do all these pieces to work now to be prepared for optimum uptake, that we also have the other tools. Maria made the point, but it's another thing to emphasize. One of the key things we're trying to do with the accelerator is to move in parallel things that we would normally do in sequence. Normally we do the research and development, then we do the manufacturing and the pre-qualification, then we work on the delivery issues. But in this, again, Maria, I think you referred to it, we're trying to do all of those almost in parallel. That's why we need the money up front. That's how we're going to be successful. If we do all the work on the R&D, we don't have the resources to do this community preparedness work, exactly as you're speaking to, we won't be as successful as we want to be, we won't get the coverage that we need, and we won't stop this as quickly as we could with this, with the new tools that are coming online.
Thank you very much, Dr.